Morning, this is Dr. Nimesh. I am a surgeon, endoscopic, laparoscopic, and GI surgeon associated with Global Hospital as a consultant and SL Raheja Fortis Hospital. I have my own hospital at others, Sanjeevani Hospital. I'm going to talk about hernia. Hernia basically is the protrusion of the abdominal wall abdominal contents through the abdominal wall that contains it. Uh, we are talking only about external hernias right now, so we will be talking about inguinal, umbilical, lumbar, incisional hernias. So inguinal hernias are hernias which occur in the groin region. They occur both in males as well as females, but however they are more common in males. They can be congenital or they can be acquired. Congenital are usually seen in the younger age group. Very rarely we see very large hernias in the adults which are congenital in nature, which we come to know only during surgery. Their congenital hernias are basically because of patent processus vaginalis, which is the track which takes the testes into the scrotum. Anyway, this is the acquired occur in any age group, seen in younger people as well as older people. Basically, they occur because of the muscle weakness or the gaps between the muscle increasing because of sudden increase in weight or sudden loss of weight. Also due to lifting heavy weights. Now, the umbilical hernias again occur in most commonly seen in obese individuals or people who are doing very hard physical labor at times. The other hernias are not so common. Incisional hernias are hernias which occur through the surgery in the past. Any surgery in the past becomes a potentially weak area on the abdominal wall, and this may give away over a period of time, and you can get protrusion of your intestine or omentum, that is abdominal fat, through that. Uh, Most often they are an elective procedure. Very rarely a patient comes in an emergency where the intestinal contents have come out and are not going back, so they can become an obstructed hernia, or very rarely they can become gangrenous and it becomes a strangulated hernia. The investigations, clinical examination is the only way that this can be confirmed. It is quite obvious even to the patient that there is a bulge which is not abnormal to that area. So that bulge reduces on lying down. This is the most common symptom or the complaint that the patient comes with. Ultrasound may be necessary at times to confirm the size of the defect. However, in small hernias in the inguinal region, the ultrasound may be helpful in trying to pick up the sac. The mainstay of treatment remains surgery. Uh, Surgery is an elective planned procedure. Very rarely, as I said, in obstructed and strangulated hernias, it is an emergency wherein the patient needs to be taken for surgery as early as possible for the benefit of the patient. The surgeries can be done either with laparoscopy or open surgery. Open surgery has been done from since time immemorial, and various kinds of meshes were used from fishnet to now polypropylene to prevent recurrences of hernia. In the laparoscopic procedure, 3 small holes are made and the hernial sac is reduced and a mesh is placed. Now, for the other hernias, and there is a special mesh which prevents adhesions of the intestine to the anterior to the mesh. However, in the inguinal hernias, a special polypropylene mesh is used. Sometimes even we use a 3D mesh which takes the shape of the pelvis bone. It's usually fixed into place using tackers, which are screws which are made up of absorbable or non-absorbable depending upon the choice of the surgeon. Typically, a patient after a laparoscopic or an open surgery should be fine to go home in 48 hours. The laparoscopic patient only has a little soreness and around the operated area in the groin. However, the open surgery patient has a little longer time of recovery because getting in and out of bed is usually difficult. Laparoscopic inguinal hernia repair for both sides hernia is a norm. One-sided is also done in certain patients who insist on doing that. Other than that, for the umbilical and the lumbar and incisional hernias, the ports, that is the holes that are made, are at different places, and the special mesh is introduced through those ports and after reducing the contents, and it is also fixed with the help of pro-tacks or tackers. Uh, Recurrences are known in both open as well as inguinal laparoscopic or umbilical hernia. More to do with patient factors rather than to do with techniques. Initially it was because of technique, because the learning curve was there, but now it is more to do with patient factors because it's a common norm doing all these procedures. That's it for now. If you need to know more about the procedures, contact me through Lybrate. Thank you.